Hello, welcome to Smile with Pediatrics. Today's topic is gut feelings in medical practice. KK was brought to the hospital by mother when he was 4 days old because he was crying excessively and vomiting repeatedly. These complaints were noticed on the second day of life. Following more detailed discussion with the doctor, mother admitted that she was not very sure if it was vomiting or regurgitation that KK was having. She also realized that she had been feeding him with concentrated formula feeds erroneously. KK was her first child, so she was just beginning to acquire mothercraft. Together with the mothercraft nurse, the doctor taught mother what to do and she was allowed to take KK home thereafter. No medicine was prescribed. Later in the evening, long after KK and mother had left, the doctor had a sudden thought to bring KK back and run some radiological tests. So he called mother and booked an appointment for the following day. On arrival the next day, mother was more relaxed and reported that KK's crying had reduced and he was now sleeping calmly most of the time. However, on examination, the doctor observed that he was now lethargic and subfebrile. Radiological investigation showed features of intestinal obstruction. KK had an emergency surgery which further revealed early stages of bile gangrene. This emergency operation saved his life. Or to put it more accurately, the doctor's gut feelings had saved KK's life. This is a practical example of how the intuition or gut feeling may come into play in clinical practice. The intuition may present as a thought or idea that comes without conscious reasoning, and it is experienced in all aspects of life. In clinical practice, a single disease entity may manifest in different ways, and sometimes the diagnosis is not very clear initially. For this reason, laboratory and radiological tests are often used to clinch the diagnosis of many diseases in routine medical practice. However, from time to time, an unpremeditated thought may guide the investigation or treatment of an index patient and can sometimes make a huge difference in the overall outcome of the disease. All the same, at all times, the intuition should be subjected to standard investigations and confirmed first as being beneficial before it is carried out on any patient. Mimi is a 12-year-old adolescent who was diagnosed with asthma 3 months ago and has had a few acute exacerbations treated in the emergency department since then. Today she is brought into the ED wheezing after she had been exposed to fumes while cooking. The doctor in the ED administered the usual medications for asthma, but this time he decided to do a chest x-ray following an unpremeditated impulse. The chest x-ray revealed the most unexpected finding. It was a severe asthma mimic. This immediately changed the diagnosis and treatment plan, as Mimi was immediately admitted for treatment by a multidisciplinary team. But for this intuition, Mimi might have been managed for many more months as an asthmatic patient, and perhaps irreparable damage might have occurred before the correct diagnosis was eventually realized. Similar events like these happen every now and then, and they show that intuition should not be ignored. In summary, there is a place for the intuition in the treatment equation, but don't jump into conclusions. First, authenticate this intuition as a treatment solution for the final resolution of the disease and complications. So do not discard the intuition, but give it some attention and then do some investigations. Thank you for joining us on Smile with Pediatrics. Please remember to like and subscribe to our channel.